The cost of health care in Vermont has been growing more rapidly than in the rest of the country. The House version of S88 indicated that the cost of health care in Vermont is estimated to increase by $1 billion from $4.9 billion to $5.9 billion by 2012. Vermont's per capita health care expenditures are estimated to be $9,463 in 2012 compared to $7,414 per capita in 2008. Why are our costs growing so rapidly?
Well, there's several reasons, and they're also happening in the rest of the country, although we are growing faster than the national average at this point. And one of the major reasons is, as we mentioned before, was the administrative costs. We're spending an enormous amount of money on administration, but again, so is the rest of the country. The other things that are happening in Vermont is that we have too much what they call capacity to meet the needs of our population. So we have more specialty care, more hospital beds, those sorts of things, and they're very expensive to have. And it's more than the population needs, and which is also why we need a healthcare system. What we need to look at is what are the needs of the population, and how many hospital beds and services do we need to meet that needs. And what we would find is that we could cut back on some of those services and not cut back on access in any way, shape, or form. So we have too much in terms of the expensive technology and whatever. We're spending too much on administration. The other thing is that we're losing primary care in general. We have we don't have enough primary care practitioners in the state of Vermont. And primary care has been shown to actually save money because people end up getting more prevention. So all of those things added together are one of the major reasons that we are expanding. And we don't have a budget in healthcare. We need to look at healthcare as a whole thing and say, okay, how much do we need for a population of 630,000 people, and where can we get the most for our money? I mean, there are areas that we really need tremendous prevention. One area I can think of is drug treatment. We don't have enough in terms of drug treatment, and what we end up seeing are ill health effects as a result of that. So that would be an area that we could put more money to once we have a healthcare system where we're looking at it as a whole. We're looking at how we're going to provide healthcare to the whole Vermont population. So that is those are the major reasons that we're spending so much more, and spending far more. In fact, over the last 8 years, we've actually seen costs almost double in Vermont. And we certainly can't sustain that. I mean, I think if people look at what were their health care costs 8 years ago, most of us did not have $10,000 deductibles. Most of us were not paying a large percentage of our medical bills out of pocket that we are now. So these are certainly some things that we have to look at into the future if we're going to still have healthcare services available to Vermonters. And that's why we need leadership in the governor's office.
This period of enormous increase in healthcare, at the same time, it's a period when there's been almost no inflation.
Right.
So the prices of other things and salaries have not gone up like that.
Absolutely. And so that's taking more and more of a bite out of household budgets. Because a lot of it, employers now can't sustain these increases. And what they're doing is passing it off onto their employees. And that's affecting families. So this is affecting every aspect of our economy. And we cannot continue. Which is also why we need to look at this as a total system. We can't just say, oh, the Medicaid population or the privately insured population or the uninsured. We have to look at this as a whole. And that's the advantage of having Professor William Shao. I don't know, we didn't really talk about this, but the amazing thing about Dr. William Shao, who was brought to the state by actually Peter Shumlin, who recognized this genius in Harvard. He's an economist, and he designed the Taiwan healthcare system back in 1995. And in 1996, this was a year after enactment, at the time when Dr. Shao got involved, he designed a system for Taiwan. Within a year, they reduced their uninsured rate from 45 to 5%. Their costs went down, and over the next several years, their costs were about 6% lower. In addition, a study just recently was released in Health Affairs that showed that the health of the population has improved over that amount of time, over what it would have been had they not enacted this reform. So we now have Dr. William Shao, who I always refer to as the Gandhi of healthcare reform. We have him designing these 3 systems for the state of Vermont. And when we say system, which means the criteria are every Vermonter has to be included. There has to be cost containment measures. There has to be a financing mechanism within this system. And he's going to cost it out and present these 3 plans to the legislature for them to choose a system for Vermont. And then it will be up to us to mobilize the forces to push the legislature along to pick the best system for the state of Vermont. So everyone will have health care. Everyone will get a card like you got when you were living in Canada. And everyone will be guaranteed access to comprehensive health care. And it will not be based on whether you're insured or not. Everyone will be insured. And we will pay in a progressive way, so based on your ability through taxes. We'll pay, again, when you look at the overall system, we will be paying less than we would have if we didn't enact a system.
The progressive part of it, that's an important feature. Peter and I were both at Bernie Sanders' Labor Day barbecue in Middlebury, and Bernie talked about the inequitable distribution of wealth in America. 1% of the population has as much money as 90% of the population.
Right.
And if that 1%, progressive taxation means that the 1% would pay their fair share. And
they'd still have enough money to live on for the rest of their lives.
Yes.
Even if they paid their fair share. I mean, I think that's really what we have to recognize, is that we as a society have to figure out what things are the right things to share. And we've already decided that with our roads. We've already decided that with our libraries, with public education. We need healthcare to be one of those things that we share the access, we share the cost, but we do it based on our ability. I mean, the fact that we put people through bankruptcies, this is the leading cause of bankruptcies, and we have people worrying about how they're going to pay their bills when they're sick. It's really inhumane, and in my view, it's un-American. I think this is really one of those things that most Americans feel should be something that everyone should have a right to.
Unfortunately, it's uniquely American at this time, because almost every other industrialized country has...
Right, including South Africa. I mean, every other industrialized country has a universal health care system that covers everyone. Every other industrialized country. I mean, what an awful thing for us to not be doing, especially when there's enough money floating around in health care to do it. It's just that we're wasting too much of it on unnecessary paperwork and billing and profit.
You also mentioned the distribution of the expensive equipment in the hospitals, that could be improved on. But I read in the paper that the hospital up in Newport, for example, because Vermont is a rural state, is very spread out. The people are spread out, and they don't have all the facilities up there that we do in Burlington. So if someone gets sick in Newport, they're not as well off as if they get sick in Burlington, are they?
Right. There's no doubt about it. There is a physical access problem whenever you're in a rural area. There's no doubt about it. I mean, what we need is basically the ability to transport those folks to high-tech areas. You don't want to have a burn unit or a trauma unit in every single hospital, and we could never afford to have that. The other thing you have to have is the need. You have to remember that they don't call it medical practice for nothing. I mean, what you really want in healthcare is you want to have areas of specialization, and you want to have them concentrated in certain areas, because the more doctors and nurses perform a certain procedure, the better they get at it. So, for example, when you're talking about transplants, you don't want to have transplant capability in every single hospital. You wouldn't be able to have the money or the need to sustain that. That's really where you have to have the patient come to the service rather than the service coming to the patient. So there are going to be some things that, in terms of physical access, there's a problem. Another one is dialysis. And what we need to do is look at the need in a certain population and how far people have to travel in order to get to that. But that's all done within a system where you're doing planning. And what you're looking at is what is the average need of the population, and where are we going to put these services so that they are going to be best utilized. We can't reproduce them all over the state. And I think that's part of the reason the hospitals have been doing that, is not because of patient need. It's because of competition. They're competing with a hospital maybe 25 miles down the road, and they want to have all the latest bells and whistles, and when they do have them, the costs go up. So what we need is a cooperative system. So in other words, that we have one hospital system throughout the state, and where we look at where do we need our cardiac, cardiothoracic surgery, where should that be located, and more than likely that's going to be Fletcher Allen. And that we don't want to reproduce those services throughout the state. We bring the patient to that service.